Hi, Felicia.
Hello. Thank
Hi.
you very much for taking the time to talk with me. I've
It's my
been wanting to
pleasure.
talk about restless leg syndrome for a while since it's a common overlapping
Great.
condition to fibromyalgia.
That is true.
So I wanted to start off by just finding out what's currently understood about restless leg syndrome scientifically.
Yeah, I think the important thing is let's first talk about what restless leg syndrome is, because a lot of people aren't familiar with what it really is. Restless leg syndrome, or RLS, is a serious medical condition that's a neurologic disorder, and it's characterized by symptoms of feeling uncontrollable, unpredictable urges to move. Which doesn't sound so terrible unless you think about they may be feeling this while they're trying to sleep, while they're at a dinner party, while they're in a movie. And typically the movement is in the legs, but it can be in the arms, head, torso, or really any part of the body.
Okay. I know that I was evaluated for it during a sleep study. Is that the most common way to get a diagnosis?
Well, the most common way is just in a regular complete history and physical with your doctor. Obviously, anybody who's having any bothersome or upsetting or disruptive medical symptoms should go talk to their doctor. Usually people go to their primary care physician. And depending on how familiar their primary care physicians are with the condition, they may treat the patient themselves or they may refer them to a neurologist, which is typically how it's diagnosed. But this is very much like fibromyalgia. This is a clinical diagnosis. A clinical diagnosis, I know you know this, but many of your readers may not know this. A clinical diagnosis is when we make the diagnosis based on the clinical signs and symptoms as opposed to having a blood test or an x-ray or a CAT scan or another diagnostic test. Of course, your doctor may order other diagnostic tests to rule out other conditions.
Right. Are most people with restless leg syndrome able to control it with alternative methods, or do most need medication, and how do those medications work?
Quite honestly, of the 23 million Americans who are believed to have restless leg syndrome, I honestly don't know what percentage of them are on drug therapy. It's certainly not half, in part because restless leg syndrome, like fibromyalgia, is very commonly misdiagnosed, undiagnosed, underdiagnosed, and misunderstood and mistreated. So, patients with RLS often have to see more than one doctor or often have to go for more than one appointment. But many times they don't even go to a doctor because they themselves don't recognize that these symptoms are indicative of a medical problem or that these symptoms can be treated. So, it's kind of a double-edged sword there.
Right. So how does having restless leg syndrome affect one's day-to-day life?
That's a great question. And as part of the Choose Your Move, Take Control of RLS campaign, we did 2 surveys. One was a survey of 1,000 people who don't have RLS, and one was a survey of people with pretty disruptive symptoms. And there was a huge disconnect, as you can imagine, between those 2 groups. What we found from the group that did not have RLS, more than half of the people said they didn't think that RLS was a serious medical problem at all. On the other hand, patients with RLS who did have significant symptoms said their symptoms were so disruptive that they interfered with their activities of daily living at least once a week. Okay. So what are we talking about? Being able to go to the movies, long car rides, being in meetings where you have to sit still, being out to dinner at a restaurant. What people can most commonly relate to is the form of RLS where they're sitting at a table with somebody and their leg is just going up and down, constantly. And you can almost feel the floor moving.
Yes, my husband likes to do that.
Well, and there is a difference between people who have a habit of doing that,
right,
and people who have the uncontrollable urge to do that, and that's the fine point of the differentiation here.
And I've read some things about possibly changing the name of the condition, and I was just wondering what's going on with that. To the Willis-Ekbom.
I'm not a fan of that, I have to say. There is discussion about it. People think that if they change the name, it will be taken more seriously. There's a whole big debate going on, and I'm not part of that debate.
Okay.
I feel like we know this is restless leg syndrome. If there's a problem with awareness, education, getting it taken more seriously, the way we do it is by talking about it like you and I are talking about it right now.
Right.
And that's yet another reason we've launched the Choose Your Move, Take Control of RLS campaign. And of course, there is a website, chooseyourmoverls.com, which has a lot more information. But I believe you combat ignorance and misinformation by providing the correct information, not by changing the name of the disease and starting over.
Mm-hmm. So with the Choose Your Move campaign, besides education and awareness, what are the other focuses and how can people get involved?
Well, the most important focus is the website. And on the website, we do have the complete information about the survey. There are video clips, including other educational videos that I have made, but some entertaining videos where we did what I call man on the street interviews, just asking random people what they thought of restless leg syndrome. And some of the answers were knowledgeable and informed, and some of them were a little bit humorous. My personal favorite is the guy who was asked, what type of doctor do you see for restless leg syndrome? And he said, a leg doctor. And of course, there is no leg doctor. Although all doctors probably, take care of the leg in some fashion. Although there are hand surgeons. But there's lots of useful information about treatment options, tips on how to discuss this with your doctor. And I think the way I would like people to get involved is to educate themselves. I'm a huge fan of knowledge as power. And I like to get involved, and the reason I'm involved with this campaign is I like to use my voice to help people with conditions that are misunderstood, overlooked, where they're frustrated, conditions where they're being told it's all in your head, and I know fibromyalgia fits into that category. This is all in your head. It starts in the brain. That doesn't mean you're fabricating the symptoms. We know that this is a result of an altered mechanism of dopamine usage. Dopamine is one of the most important neurotransmitters in the brain, so it sends messages from one nerve to another very simplistically, and that affects all of your peripheral movements. So this is not one of those conditions which should be taken lightly, and yet it is. And it affects 23 million Americans. Another reason that I'm particularly interested in this condition is I tend to embrace conditions that affect women disproportionately. And so twice as many women as men have RLS.
I see. Well, thanks so much for your time. I think my readers and I will
gain
a lot of new knowledge about it, and hopefully we'll all be able to get involved with the Choose Your Move campaign ourselves, too.
Great. That would be wonderful. Thank you so much for covering this important topic.